Borderline personality disorder. What is borderline personality disorder? 1. A minor stress leads to extreme emotional reactivity, anger, anxiety, or depression, that usually lasts from a few hours to a few days. 2. A pattern of intense, chaotic interpersonal relationships. 3. Marked identity disturbance. 4. Impulsive behaviors that are potentially self-damaging. 5. Recurrent suicidal gestures, threats, or self-mutilating behavior. 6. Chronic feelings of emptiness and boredom. 7. Frequent eruptions of intense, inappropriate anger. 8. Easily feels unfairly treated and believes that others can't be trusted. 9. Analyzes most issues in simple terms, for example, right wrong, black white, trustworthy deceitful, without regard for extenuating circumstances or complex situations. 10. Becomes very anxious with any hint of perceived abandonment in a relationship. Goals. 1. Develop and demonstrate coping skills to deal with mood swings. 2. Develop the ability to control impulsive behavior. 3. Replace negative thinking with the ability to tolerate people and issues. 4. Develop and demonstrate anger management skills. 5. Learn and practice interpersonal relationship skills. 6. Terminate self-damaging behaviors, such as substance abuse, reckless driving, sexual acting out, binge eating, or suicidal behaviors. Solutions. 1. Participate in a group, preferably, or individual personal skills development course. Conduct group or individual skills training tailored to your identified problem behavioral patterns, for example, assertiveness for abusive relationships, cognitive strategies for identifying and controlling financial, sexual, and other impulsivity. 2. Use behavioral strategies to teach identified skills, for example, instruction, modeling, advising, strengthen them, for example, role-playing, exposure exercises, and use in everyday life. 3. Verbalize a decreased emotional response to previous or current post-traumatic stress. After adaptive behavioral patterns and emotional regulation skills are evident, remembering and accepting the facts of previous trauma, reducing denial and increasing insight into its effects, reducing maladaptive emotional and/or behavioral responses to trauma-related stimuli, and reducing self-blame. 4. Identify, challenge, and replace fearful self-talk with positive self-talk. Explore your self-talk that controls previous fears. Identify and challenge it by generating thoughts that build confidence. 5. Identify fearful self-talk and create positive alternatives. Review and reinforce success, providing corrective feedback for failure, and write down and replace self-defeating thoughts. 6. Reinforce the positive cognitive messages that enhance self-confidence and increase action.